absolutely fantastic session there from Christine, and what we're seeking to do with this whole section is to get those other perspectives, and to have the perspective from what's going on in the US market was absolutely fantastic. But also peer-to-peer is a very established concept, both in mental health but also across the wider university. And we're now going to have an absolutely fantastic keynote from Julia Haas, who works at King's College London and is also a trainer for Student Minds. I had a fantastic chat with her over Zoom a couple of weeks ago, and I'm really, really excited to hear her thoughts. And I think we're going to all learn a huge amount from sort of understanding how peer-to-peer works in sort of other contexts. So over to you, Julia.
Oh, thank you so much, Mike. It's great to be here. We have a little bit of an echo. Okay. Yeah, so I'm Julia Haas, and we have another North American here for you. Thanks, Christine. It was so great to hear from you. I am based in London, and I work at King's College London, actually in the Students' Union. So I'm the Student Wellbeing and Welfare Manager there. And it's interesting because my role is actually funded by the university, but I sit in the Student Union because everything I do is basically about supporting students to support each other to create communities of good well-being, really from the ground up. So we're working in partnership with students, which means that being based in the Student Union is really helpful. So the Student Minds, they're the UK's student mental health charity, and they are based up in Leeds, and I'm an associate trainer with them. So I've been trained to train other trainers, which is kind of confusing, in peer support, as well as look after your mate training, which I'll go into a little bit later on. And also, yeah, so they do lots of really cool things, and I'll talk to you a little bit about what they can offer. But we're using their Twitter actually, because I don't know what's happened to me, but it's 2020 and I don't really use Twitter. So that's a bit awkward. But so I've been working for 8 years in student engagement and peer support in universities. And actually I kind of changed my whole career. I was planning to go into medicine, but I was working at a university. I was a student staff at a university, and I decided to change my whole career because I worked as running a peer health education program, and it totally changed my mind on what I wanted to do. And so I'm really excited to be here and talk about peer support with you, because it's a big deal to me, and I'm really excited to share kind of about the mental health and well-being landscape and how that can be beneficial. So we're gonna talk through the kind of like what peer support is. So we've been using different terms like peer-to-peer, students as partners, lots of different terms going on here. So I want to clarify a little bit about peer support in the landscape of mental health and well-being. And then we're going to give you a little bit of a case study of what's happening at King's when it comes to peer support. And then there'll be space at the end to ask any questions that you might have. So we all know that university is a pretty challenging time for a lot of students. I have loads of students say to me, like, I was told that university was supposed to be like the best years of my life. This is actually really hard. Fair play. There are lots of challenges coming to university. It's a big life change for many. Statistically, 75% of mental health difficulties tend to develop before the age of 25, which means that lots of university students, if they're going to develop mental health difficulties, it's going to be during university, if they're attending university. But we also know statistically that 29% of university students are experiencing psychological distress, which can be associated with higher levels of anxiety and depression and personality disorders and substance use. And out of 1,000 students, 8 out of 10 are talking that they're experiencing stress and anxiety, with 45% of students experiencing depression. Those numbers are kind of changing a lot, and sometimes it's really hard to actually measure these because only 3.5% of students are really disclosing to their universities that they have mental health difficulties. So it can be quite difficult to measure and know what's really going on. But anecdotally speaking, most people would agree that it seems like the mental health of students isn't great at university, and we are definitely seeing that. We also know that student mental health definitely has an impact on retention. So stress alone can have a major impact on mood and sense of well-being, behavior and health, as well as their academic performance. So when you have mental health difficulties, you might be missing classes, which means you have reduced academic performance, which also means that maybe you're having significant interpersonal issues with friends, and you're not like fitting in, and that can just have such an impact on your experience at university. And in talking about in terms of money, it's kind of weird to bring that into the conversation, but HEFKE estimates that when a student leaves university and they drop out, it costs the university around £33,000 for the life cycle of the university. So if we're talking about retention, which is of interest to lots of universities these days, that's kind of like a numbers game of why we should be thinking about student mental health and well-being at university, aside from just wanting to create a place where people can have a nice time. So really, belonging and peer support, retention are actually all connected. So transition into second year is especially tricky for lots of students. 1 in 5 students didn't really feel supported by their university when they started, and really their biggest worry was about making friends. And students can really impact the experience that other students are having. When you increase peer support and it's widely used, you can increase retention and student success because you're creating this sense of belonging where people can fit in. In the case of students disclosing mental health difficulties to their university, being about 3.5%, 75% of those were telling their friends about it. So we know that students are turning to students, like Christine talked about. You turn to the people you trust. You turn to the people who are their low barriers, and that you don't have to understand loads about the university to know about. And so that's why we really believe in peer support, and that's the type of term that I use in this, as a space for students to feel supported by each other and create university communities where students feel that they are empowered to help themselves and also empowered to help others. So thinking a little bit for you, we're like I said, we're using lots of terms when it comes to peer support in higher education. And so kind of what does that really mean to you when you're thinking about peer support in the landscape of mental health and well-being? Like, have a little think about what that actually means to you. Is that like a mentoring scheme? Is that like something through the counseling center? Like, what sort of things have you seen, and kind of what does that mean to you? Just have like a little thought about that. So this is the tricky part about peer support, is that, as we've talked about, there's lots of different ways to talk about it. So you might be saying peer-to-peer, you might be saying like student leadership, like there's lots of different ways to talk about peer support, which makes it awfully difficult to share good practice with this area. I've talked to universities across the UK, and they're all talking about it in different ways, and they're all meaning different things. So I went and set out to do a study to say, okay, what are we talking about when we talk about peer support? Because actually language is quite important for us to learn to share good practice. Because there really is very little good practice that's set in the UK when it comes to peer support. So I did a review looking at kind of like, what is the shared language? How can we share that so that we can start to share good practice across the country and start to learn from each other? So I'm going to just go through kind of what the 4 different types of peer support are, because that's what I found, and then sort of how they benefit the different areas of the student journey, and then talk to you specifically about a case study. So peer support can mean lots of things, as I think I've well established. Peer support, the term kind of tends to come, a lot of people talk about it coming from like Alcoholics Anonymous in the United States is a term that was used there. But based on the context that you're using it in, it can mean really different things. It can be everything from a careers team to maybe even an advice team, like at King's we have money mentors. So there's lots of different things and different ways it can be meant. But what we say at university is, it's all about a shared experience. That's really what peer support is. So if university is considered the shared experience, then all university students are really peers in that. And so they can support each other. And so on the most basic level, that's what we kind of mean when we talk about peer support at university. Now you can definitely get down into more granular groups that have specific experiences that are unique to them. Like we were just starting a Black Students Talk peer support group at King's, for example. There's lots of universities who will do LGBTQIA+ groups. And so there's lots of like, you can get down to some more specific experiences, but as a whole, we're saying peer support is students supporting each other at university. Now, of course, we have informal peer support that happens all the time. It's a super natural part of university that you ask a mate like, oh, how, I don't understand how to use this timetabling process or anything like that. Usually lots of practical things. And they help each other, and that's great. We would never want to change that, right? But it's pretty hard to measure that, to grow that. And also there's like no training in place for informal peer support. And so it's a little bit risky. And when we're talking about student mental health and well-being, if that's the only way that it's done, because the students might not be signposting students correctly or looking after themselves correctly. So what I'm going to talk about more is formal peer support. And that is really, it's quite an intentional thing to build student communities and to share experiences and support students to get right access to help. So the first type of peer support that we're going to go through is peer run support. So that is basically for students who are experiencing difficulties. A lot of times this has mental health difficulties. This tends to be kind of what this is made for. There's lots of different types within that. You can do like one-to-ones, which is the Oxford model. Students are trained to have one-to-one conversations that are supportive for students who are having a difficult time. We also have group sessions, which Student Minds has lots of set group sessions for students experiencing low mood or mild depression, as well as eating difficulties. And those are group spaces where there's 2 peer support facilitators who are trained to make those safe spaces really supportive. And then we also have remote services like Nightline, which is in the UK, but there's lots of different texting services and things like that as well. So peer run support is basically for any student who's maybe having a difficult time while they're at university. The other is peer health education. So peer health education is basically a way to upskill students to do health promotion on your campus. Now, peer health education is basically how I got into peer support. It's what I did in the United States at the University of Wisconsin-Stout. Little Wisconsin. I actually have a photo of the team right here. They're very sweet. So they'll do things like sexual health education, nutrition and physical activity, stress, time management, resilience, and then well-being sessions as well. Student Minds currently has a new well-being session that I actually wrote for them. That's a 3-part program for peer support facilitators to run for students to think about their well-being, self-care, and kind of dealing with stress and setbacks. It's really resilience-based. And so that's a really supportive group to do health promotion, basically. And then we have peer mentoring. So these can be anything from like buddy programs to parent programs, family programs. Lots of them have weird names going on. But it's really just like a more advanced or experienced individual guiding less experienced individual. And that just means basically first year is getting paired up or in like a little group with second or third years or whatever that is. And it can really has an impact on academic success and students transition into university. It has lots of improvements there, the research shows. The programs that have the most engagement are those opt-out programs. So every first year is automatically put with a mentor. You have to have lots of resource to manage that, but they have the most engagement for sure. The research really shows that you need to have training for these programs. I see in the UK lots of programs that are kind of running without training. Actually at King's, that's an issue that I'm trying to deal with at the moment because it's not if a student comes to their mentor and has an issue, especially a mental health issue, it's kind of when, because we know so many students are having difficulties. And if you have a good relationship with a mentor, you're going to be talking to them about it. There's also lots of questions about reporting. It can be difficult to do. I know we kind of talked about evaluation when we were talking about the career mentors. It is difficult. Lots of times it's very number-based, but really we want to be talking to students who are actually receiving the mentorship about what their experience was so we can improve it and see, is it something that we think is as good as we think it is? So then we have peer-assisted learning, which is really for more like academic programs. So you'll have a student who's trained up to be a tutor and run like a tutor group that's for basic academic skills. It's really helpful for first year students, but once again, it can really be used anytime. And there's some international programs who have really good set practice of how to run these programs in faculties, but they do tend to be quite faculty based. Although we see that some programs run them centrally and they're like locally owned. So those are sort of the 4 different types of peer support that can improve student mental health and well-being. Overall, what I found from the research is that really they can improve retention, belonging, and general well-being as well. I think it's important to clarify though with this type of peer support in particular is that it is not a replacement for services. Students still need professional services. In all of the training that I do for students, it's so clear you are not a professional. You are not giving advice. You are listening. You are active listening. You are signposting. You're having boundaries, and then you're looking after yourself in that process as well. Peer support is about building communities that students belong and feel that they can thrive. It's about changing our communities to be places where students can really thrive. And so it is definitely something that can complement services and signpost into services, but it's not a replacement for services. So this is just like a brief overview of the different types. Basically, peer-run support, peer health education, they tend to be kind of for any student, specifically peer-run support for those experiencing difficulties, peer health education for any student, and kind of peer mentoring and peer-assisted learning tend to be really good for first-year students. Now at King's, we use Student Minds and the different trainings that they have, and I can go through that a little bit more if that's of interest to you. But there's other, like the International Academic Peer Learning Network, they do the peer-assisted learning, and they're really useful for lots of resources and training. So yeah, that's kind of like an overview of the different types of peer support, so that hopefully in the country, I shared that at the Student Mental Health Research Network conference in December. I'm hoping we can start sharing some language and then sharing good practice, because it's everyone, I would say, in the UK is doing peer support really in different ways. And so when I did that piece of research, I talked to about 12 universities across the UK and how things were going, but it was quite helpful to like actually identify what type of peer support they were doing so we could compare programs. And so that's really helpful in the beginning. But now we have at the Student Union at King's, we have the positive peers, and they're a bit of a hybrid. It's quite unusual to have a hybrid like this, but it's based more on my background in peer health education and then wanting to incorporate peer-run support, because we know students need a lot of mental health support. So the positive peers are a hybrid team that are really ambassadors for the work that I do at KCLSU Wellbeing. So firstly, they run check-ins for students. And so this is virtual this year. It's quite new this year, actually. And basically, new students will have schedule a Teams conversation with one of our positive peers. It's about 20 minutes long. And it will go through like all like the support services through a conversation, because students sometimes really struggle to get connected in with support services, and it can be too late or quite long, like late down the line when they actually have conversations with support services and when they need help. So the King's check-ins have been really successful. We just like launched them a few days ago. We've had like 60 one-to-one conversations, which is great. And that's what all the positive peers are doing. But I went to the University of British Columbia to learn how their peer support is going a few years back. And they had their peer support team in 3 different teams. And so I kind of taken that model as well at KCLSU. So we have our peer-run support team. So that's the student team who's running Positive Minds for students experiencing low mood or mild depression. That's set by Student Minds. They also have a one-to-one function. So students want to have a chat with them, they can if they're feeling a bit down, or they just want to talk to someone who's trying to have a conversation like that. Then we have our peer health education. So they are running cooking and conversation, which is just like making some food and having a chat. It's just building community, and we'll be doing that online, I guess, in the first term. And then also Thrive, which is a Student Minds program that I help write, which is looking at improving well-being, self-care, and resilience for students, and it's a 3-part program. Now, my peer-run support team and peer health education team are all trained in the Student Minds peer support sort of umbrella, which is quite an in-depth training that goes through value like expectations and boundaries and having safe spaces and facilitating that and all those really important things. And then the engagement and the online support team are really about building a community where we can support each other online. So it's like podcasts and blogs, social media, newsletters. And they also help co-create a Wellbeing Hub, which is where we have all students going to this year to find events, activities, and resources that boost their health well-being. So it's really a health promotion space. And the positive peers in the engagement and online support team are helping to develop that. They don't have that super in-depth training because it's about 18 hours of training. The engagement and online support team do the 2.5 hours of look after your mate training by Student Minds that I deliver to them because I've been trained to deliver that for them. So they have some basic mental health literacy, how to support a friend who's having a difficult time, how to have that conversation, and then how to signpost them, most importantly, and then how to look after themselves in that. So that's kind of what the positive peers do. Now, here's a little picture of a few of them. It tends to be lots of females who go for the role. We're working on it. But right now we have grown that team that's right there that you see to about 36 this year. So it's really, really growing. And we do have some males, which is great. But kind of the lessons that I've learned running this program is that training is so important. Training is very important for building the expectations and boundaries to make them safe spaces, because lots of people get a little bit worried about students having conversations like this and creating spaces like this. And so the training is really integral to that. And that's why I've appreciated working with student minds on it, because they have already thought about all of that. Some universities I talk to have set their own training through maybe their counseling center, and that's fine. But I appreciate that Student Minds has written a confidentiality policy, a well-being policy for volunteers, and things that are really important for having those spaces be very safe. Also, evaluation is very key in this. I have to demonstrate impacts, of course, and Student Minds helps me think through exactly the type of evaluation that I want to do for the peer groups, but then we try to get a mix of quantitative and qualitative evaluation from the students as well. Really key in this, if you're starting to think about running or starting up any sort of peer support at your university, is partnering with faculty, is partnering with lots of people across the university, because if you just start up a program and try to tell a few people about it through email, it won't really take off. Believe me, I did that about 4 years ago. It's really integral to have good partnerships with faculty so they can promote it to their students and really understand why we're doing this, what's the importance of it. And the positive peers are actually part of a wider network at King's. So we have well-being leads who are student leaders who are in societies, sport clubs, activity groups, the whole spread, and they're trained in that look after your mate training. So they have that basic mental health literacy of how to support their friends and create communities with health promotion in mind and prevention, and building these kind of healthy communities of good well-being. So the positive peers are trained at a bit of a higher level, but those well-being leads are also trained and part of this wider network. So they see themselves as, we are together trying to make King's a place where students belong and can thrive. So, and I think I've covered lots of that Student Minds does in supporting this work. I've talked to lots of universities. The general challenges tend to be evaluation and also people running them in different ways. So if you do find that you're getting peer support groups across your university, trying to bring them together, at least whoever is leading them is maybe having a conversation every once in a while so that you're working together and can create a wider network, I think makes a much bigger change at a university. So there isn't a lot of consistent training or expectations in peer support, but I think that's something that in the sector we're thinking about, and Student Minds is probably going to be quite integral for that moving forward. But yeah, any sort of questions or thoughts, very, very open to. It was quite a whirlwind tour.
Thanks so much, Julia. That was absolutely fantastic. So while we give our audience a chance to sort of post their questions in the Q&A section, I've got a few that's come in already. One of the key challenges in lots of work with students is how we engage those that need help but don't necessarily seek help. And I understand that's a key challenge, particularly in the mental health space and wellbeing space. So have you got any tips on that, or things that have worked in your area?
Yeah, I think that is a huge challenge in this space, and generally in student engagement. Engaging students who aren't engaged is a huge challenge. And that's why I think students are such key partners, because students are, for lack of a better term, on the ground. They're seeing their peers, right? And so the more students that you can train to be able to recognize if their peer isn't okay and feel confident to be able to have that conversation, the better. And even if it's just that they're signposting or letting services know that there's a student that they're worried about, and having systems in place for that, that's really important. But I think students as partners is definitely the most important key. From our perspective, good well-being should be accessible for everyone, no matter your background. And that's why students are such key partners in that. So I think it's about training a lot of students. It's about opening up the conversation and making students feel that they are part of that community and building that.
Excellent. We work a lot in partnership with Student Minds, and we've developed a community of practice, really looking at that sort of transition point into sort of graduate employment and that next step. And we know that that's a key risk point. We also know that students applying for jobs and that process, which can be quite difficult, can be an area that has an impact, particularly on mental health and well-being. How do you think career services can partner or better partner with the other peer-to-peer provision that exists within a university?
Yeah, I think that talking to other peer programs that are happening, but I think basically students should be having this conversation more. Like, I talk to so many students who are like, I didn't realize that other students were struggling with this. I thought I was alone in this. And so, especially in that kind of like transition period, the conversation should be opened up more and led by students. If this is normal, these struggles are normal. And so I would really urge career services, if they don't have students who are student staff who can maybe share stories like through blogs or whatever it is, that you reach out to other student services who may be running peer support programs so that you can start a conversation about the challenges and make it normal, because it is normal, right?
Yeah, of course. And you mentioned sort of sometimes the challenge around evaluation, and we know that can be difficult, and you can see fantastic work going on, but picking those, useful impact measures can sometimes be difficult. Have you got any top tips for sort of effective evaluation of peer support mechanisms?
Oh man, I mean, it's really tough because I have students who are running programs that I'm not at. So just getting the basics of numbers is quite difficult to collect. But really, I think like understanding what the point of what you're doing is and trying to measure that and work with colleagues who maybe have more experience in that is really helpful. But I think getting student stories where possible is really important, and trying to mix quantitative and qualitative things. There's a lot of resources out there about, validated survey questions you can use. Like the Student Minds uses the shortened Warwick Edinburgh scale of well-being. So you need to know what your outcome is. And there's lots of resources to do that. But yeah, one barrier is definitely getting the feedback at all, which is something that is difficult, but if you can try to incorporate it into programming, that's important.
And if you had one piece of advice for people that are sort of maybe starting a peer support mechanism from scratch or for the first time, sort of maybe one pitfall to avoid, or one thing to definitely make sure that you include, what would that be?
Well, I think the biggest learning of everything I do is that don't plan a program on your own. Do it with students. So identify some key students, bring them on board to plan what this is going to look like, to make sure that it's actually relevant and meaningful for students. And with that, I think my biggest learning is students need a lot of structure in order to incorporate. My students are volunteers, for example, so incorporate volunteering into their life. And what that looks like. So I think there's like a lot of structure that's required from the beginning, but then that can move more smoothly, and you can actually appoint even student leaders who are in charge of some students. So I have 5 student supervisors who are managing a team of 35 students, which is great professional development for them, but it's taken a few years to get there. So I think structure and making sure that students are part of the journey.
Thank you so much. And yeah, it's been a fascinating insight, and to have that sort of perspective and all of the research and work that you've done as well to sort of really try and define it and add in some sort of almost quality control and best practice to what is such an important part of our sector. So thank you very, very much. It's been really, really great.
Thank you for having me. It's been great to be here.